Hi there, everyone. It is great to be here today. My name is Sarah Hunstead. I am a paediatric nurse, mum of two, and founder of CPR Kids. And today we are talking, I am talking about fever in babies and kids. Now, I love talking about this because it is just one of those things that, everybody is going to encounter at some stage. It's just, your kids are going to get a fever. So today what we're going to do is we're going to go through what fever is, when you need to see a doctor, what you can do at home, and the red flags to look out for, and a few stories in there too. And of course, please ask questions. All right. That's what I'm here for. Please ask lots of questions. Obviously, I cannot give specific medical advice, but general questions, absolutely, I can. And please tell me your stories too. Pop them in the comments below. So I'm coming to you from Bidjigal land today. So please also let me know in the comments where you are tuning in from. So now, what are we doing? Let's start. Okay. Fever, what is it? All right. So fever is when the body heats itself up at its own request, and I'll go into that a little bit more, to kill any virus or bacteria. That's pretty much the aim of it. It's part of our defense mechanism as such, because it's part of our immune system. It's part of our immune response. So the aim is that it's a defense mechanism. So let's go into that a little bit more. So what happens is that when we get, a virus or a bacteria, most commonly it's a virus, then what happens is the center in our brain that controls our temperature goes, well, hang on a sec. All right, I've been told that we have a virus, bacteria, we've gotten an infection, okay? So part of our defense mechanism here is we are going to heat ourselves up. So usually our temperature fluctuates between somewhere around, 36.5 to 37.5, goes up and down different times during the day as well. So it's normal for it to fluctuate. But what happens is that center in our brain goes, okay, instead of staying between around, 36.5, 37.5, somewhere in between there somewhere, whatever is, your child's normal kind of set-ish point, we are going to elevate that up. So part of our response is we're going to try and heat that up. It's a natural response. And so a fever is classified as a temperature above 38 degrees Celsius. Okay. And so that is absolutely part of our body's defense mechanism. It's a good thing because often, we can think, oh, fever, it's bad, a lot of the myths out there, that your child can get brain damage from a fever, that a fever is a terrible thing and you have to quickly lower it down. They're all myths, and we'll go into that a little bit more now. But what I want you to take away from my, I suppose, little bit of rambling there is that fever is a natural response to infection. It is not the illness, okay? So that's the important thing. Fever is the natural response to infection. It is not the illness, okay? So that's really, really important. So, okay, I can hear you saying, well, Sarah, you're telling me this is a natural process, but isn't it kind of don't you feel like crap when you've got a fever? And yeah, you do. You absolutely do. I don't know if you've had a fever as a grown-up, but you do. You feel like crap. And kids can feel like that too. And so what we do is that we give them, the paracetamol or the ibuprofen, not to bring down the fever, but to simply make them feel more comfortable. And that's the really important thing. So the aim of the game here, when you give your child paracetamol or ibuprofen, that's something you need to discuss with your doctor or pharmacist if you're not sure what one to give them. Both of them are pain-relieving medications that do reduce your temperature during fever. Now, it's not to bring down that number, okay? It is simply to make your child feel more comfortable, because you can feel crappy when you've got a fever. Okay, so be aware of that. It's simply to make them feel more comfortable, because I know a lot of parents worry when, for example, your child might have a temperature of 39, and then you might give them some paracetamol, ibuprofen, and the temperature just comes down to, say, 38.5. And I know people really worry about that and go, but it hasn't gotten rid of the fever. That's not what we want it to do. It's not what the aim of the game. The aim of the game is simply to make them feel better so that they are drinking well, okay, because we don't want them to get dehydrated, so that they're drinking well, we're relieving any pain, and we're helping them feel more comfortable. So that is the aim of it, okay? So now, do you have to give it the paracetamol or ibuprofen if a child has a fever? No, you don't have to if they are comfortable. If they are comfortable, they're interactive, they are drinking well, and they seem settled in themselves, no, you don't have to give it. But if they are uncomfortable, if you see that, they're not wanting to drink, if they just look miserable, then by all means, of course you can. But please follow the directions on the bottle or the packet of the medication. Okay, really, really important that you do that. All right. So now, can we talk about a little exception to the rule here? Now, I often say that even though, we do measure our child's temperature, it's not about the number, okay? So you're probably thinking to yourself, hang on a sec, isn't a fever of 40 dangerous? No, okay. So the body's incredible. Our body is so smart. And what it does is it's setting that temperature. Okay. So, illness and kids can get really, really sick from the infection. But remember, it's the infection that's making your child sick, not the fever. The fever is a natural response to the infection. So if your child has a temperature of 40, does that mean that it's more dangerous than a child who has a temperature of 38.5? Well, let's go into that now. Now, there is an exception to the rule before we get into this, and that is a child who is baby under the age of 3 months. Okay, so 3 months and under. If they have a temperature of 38 degrees or above, it's really, really important that you seek urgent medical help because they're little. We want to know the cause of the fever, because remember, fever isn't the illness. They are little. They don't have the immune system and defenses that, you or I do, or an older child does to, defend against that infection. So it's really, really important that they are seen urgently, whether that is getting straight into your GP, whether it's presenting at an urgent care centre, whether it is presenting in an emergency department, your local one. If you're in doubt, give Health Direct or Nurse on Call a ring, and they will direct you as to what you need to do as well. But you do need to, even if they look fine, if they have a temperature above 38 degrees, they need to have a medical review. Really, really important. And of course, remember, if your baby is not responding as they should, if they're having difficulty breathing, if they are unconscious, any of those emergency signs, you call 000 immediately for an ambulance, or whatever country you're in, the number for ambulance. Okay, so we've talked about the babies. Now let's get on to the other kids. So we asked the question, is a temperature of 40 more dangerous than a temperature of 38.5? For example, I'm just pulling random numbers here. Okay, so what I want you to do is look at your child, not the number. Okay, so I'm going to tell you a story, and those of you, and I'm noticing who's watching at the moment, some of you have heard my fever talks before. Now's the time to go make yourself a cup of tea. Really quick one, because I'm going to tell the story that I always tell. But it's such an important story because it just illustrates perfectly how, or to answer that question. So my story. When my two girls were much younger, they both had an infection. So they were both sick. I had one with a temperature of 38.2 or 38.5, somewhere out there. Can't remember. It was low 38s. and she was she wasn't unresponsive, but I had to really kind of, stimulate her to wake up. So she was probably about 3 at the time, I think, somewhere around there, about 3. But she was laying on the couch. She was so lethargic and just wanting to sleep the whole time, which was unusual for her. So I had to wake her up to have sips of fluid, sips of her drinks, and she just wasn't interested at all. So she was lethargic. She didn't want to drink. She was, her skin color, she was quite pale for her. Her lips were really pale. So she just didn't look good. She wasn't having any difficulty breathing. That was fine. But what I realized as well, she hadn't weed for over like 14 hours. Like, it was a long time that she hadn't weed for. And she just, they're all red flags. I was really worried about her, and she had temperature low 38s. My other one, she was 2 at the time, about a year apart-ish. She was absolutely, looking okay. She wasn't her normal self, but she was sitting up watching TV, eating ice blocks, and she had a temperature of 40. Okay. Was she her normal self? No. But she was interactive. She was drinking. She had good wet nappies. She was a bit more pale than usual, but she was okay. Who was I more worried about? I was more worried about my other one with the lower temperature, like the 38.2 or 5 or whatever it was, who was, not difficult to rouse, but just was requiring rousing. So she was lethargic. She wasn't drinking. She wasn't weeing. She was pale. She just was not, she looked unwell. She actually ended up in hospital on intravenous antibiotics because she had a bacterial infection. She had strep throat, but she was quite unwell. And my other one, who also had strep throat but had a milder illness, she ended up needing some oral antibiotics and was fine to stay at home. And she was okay. So it's not about the number, unless, of course, we talked about bub under 3 months. It's about looking at your child as a whole. That's the important thing. Okay, really, really important. Look at your child. All right, so rather than just the number, look at your child too. You don't need to focus on just that. And of course, here I am talking about antibiotics. So remember, antibiotics are only useful for bacterial infections. They do not help with viral infections. And according to the Royal Children's Hospital in Melbourne, the majority of fever in kids is caused by viral infections. So that's something to note as well. Remember, antibiotics do not help viral infections at all. Okay, they don't. So some key points that we've talked about so far that are takeaways. Number 1, okay, it's not about the number. Look at your child, unless they're under 3 months. So young babies, so babies under the age of 3 months, need urgent medical review if they have a fever over 38 degrees. We established that a fever is generally classified as a temperature of 38 degrees or over, and that a fever is the body's natural defense, okay? It is the body's natural response to infection, and fever in itself is not harmful, okay? Really important. The other thing that we covered was paracetamol and ibuprofen. We don't give them to lower the temperature. We give them to make our child feel more comfortable, okay? Really, really important that it is for them to feel more comfortable rather than trying to lower that temperature. So when do you have to take your child to the doctor? So we've talked about, young babies. So first of all, it's about finding out why they've got the fever. So if you've got, an older child, like, around the age of, 3 or above, they've got a cold, runny nose, they're sniffly, the rest of the household's got a cold, they've got a fever, they're drinking well, you're happy, kind of going on, they're not, they're okay. Absolutely. You can just monitor them at home. That's not a problem. But if they show any of those red flags, and we've got lots of blogs on the red flags, and also I'm going to put a link in the comments below as well. So those of you watching on Instagram, I just want you to Google the Sydney Children's Hospital fact sheet on fever, or the Royal Children's in Melbourne fact sheet on fever, or Queensland Children's Hospital fact sheet on fever. Just Google fact sheet on fever in the hospital that's close to you, or anyone you want, and you will find that it's got all of this information in it. They are absolutely fantastic and the thing to look at. So, and remember, if in doubt, call Health Direct or Nurse on Call. Or there are so many urgent care clinics that are popping up around Australia at the moment. So make sure that you Google urgent care clinics in your area. They are an alternative for things that don't need to be seen in the emergency department, but need a bit more of an escalation than the GP, or it's after hours. So they are a fantastic resource. So please search and see what urgent care clinics are in your area. And those of you in rural areas, you will know what is available for you. But remember, Health Direct and Nurse on Call are always on the other end of the phone too. So when do you need to see a doctor? So first of all, if they've got a fever and they look really sick, okay, they've got those red flags, you're worried about them, please take them to the doctor, okay? So if they have a chronic illness or a comorbidity, meaning that they have another illness or disease, that means that a fever is bad for them, and you will know if your child has that, then please follow your child's action plan. So if they are also, your child's in pain that isn't relieved as well by, the paracetamol, ibuprofen, or it's continuing on, that's worrying. If they're having any breathing problems at all, and if they are in severe respiratory distress, 000 ambulance, please. Okay, and we've got another video on what to look for there and lots of posts, so go and have a look at those as well. Okay, what else? If they are complaining that they have got, any difficulty swallowing, obviously that's hard to tell in young ones, but they might be drooling and unable to have their feeds properly. If they are complaining of neck pain or neck stiffness, they don't like light, they've got a rash that when you press on it, it doesn't go away. So those sorts of things as well. Even if they just have a rash with a fever, they need to be seen by the GP, okay? Obviously, if they have a fever for more than 3 days and it hasn't resolved, then you need to see a GP. Or if they are drowsy or sleepy, that's a red flag. That's something that, really is quite worrying. And I guess it's one of those things where I know it's easy for me to say, but trust your gut, okay? Trust your instinct. If you are worried about your child, seek medical advice, okay? Really important. You know your child better than anyone. If you feel that they are getting worse, we expect a child who's fighting infection to start to get better. If they're getting worse, if you're worried about them, seek medical help, please. Okay, so really, really important. And what can you do if your child, does just have that, cold, runny nose, the rest of the family's got it, they've got a, fever, and you're just like, no, they're okay. They're all right. They're not under 3 months of age. They're not a baby. They're a little bit older. Then just make sure that they're getting plenty of fluids, because you can get dehydrated more, faster when you've got a fever. Give them lots and lots of fluid to drink. Give them ibuprofen or paracetamol for comfort only, not to lower the temperature, and just have them dressed in something that, that is appropriate for the room. We don't need to strip them off completely and, be fanning them. That's not recommended. Cold baths are not recommended. Just have something loose and light that's appropriate for the room that you're in, so that they're not shivering and they're not sweating, pretty much. Okay. So remember, please, 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 go and grab the fact sheets, okay, that I've mentioned. So those watching on YouTube and Facebook, I'll pop that in the comments. Instagrammers, can you play? I just showed my age then, didn't I? It's probably not the cool term to use. I am a Gen X, so please forgive me for that. I can see people just shaking their heads going, Sarah, you have no idea about the Instagram. You're right. I don't, but I'm here. Anyway, so please get the fact sheets. People who are watching on Instagram, what I really want you to do is go to Sydney Children's Hospital, Royal Children's Hospital, Queensland Children's Hospital, download their fact sheets. Okay? Absolutely fantastic. Just type that into Google with fever or whatever search engine you use, and you will find it. So, any questions at all, now is the time to ask. Please just pop them in the comments below if you have a question on fever. But hopefully what we've done is that we have we have been, sorry, I got distracted. You can tell I absolutely got distracted then because I'm actually broadcasting to two different cameras here, and one went off and then one didn't. And yeah, this is all too confusing for my brain. I'm going to have to stop now before I can, you know what's happening now as well. Casey, who is the CPR Kids digital manager, she is going to be falling off her chair laughing at me right now. Yeah, so anyway, that's okay. I know my limitations. So thank you so much, everyone. We will be back again soon with another Facebook Live. And remember, send in your requests for what you would like us to talk about. Okay, we'll see you soon, everyone. Bye.